Hi there, Dr. Davin Lim, board certified laser dermatologist. Today's topic we'll be talking about keloid scarring. There are many types of keloid scars and many causes of keloid scars, including spontaneous keloids, keloid secondary to piercings, burns, trauma, acne, and even scarring secondary to surgical procedures. But today we're going to be concentrating on how to treat keloids, in particular how to treat keloids on the ear. There are numerous methods to treat keloids on the ear, everything ranging from intralesional steroids through to lasers, surgery, even radiotherapy. But today I'll be focusing on how I treat this particular keloid scar. I find that my method, which I use, has one of the lowest recurrence rates of any keloid procedure out there. This may not be the way everyone does things, but this is the way how I perform the surgery. Okay, so look, hey, this is not what we normally see. This is excessive keloids. Normal keloids we normally see on a daily basis look like these, and they're usually secondary to ear piercings. So, what can we do? First of all, CO2 laser is a really good method. You can see how fast and efficient it is to actually cut out the keloid. And the great thing about it as well is that it coagulates. So in other words, it stops the blood from actually flowing. So it's a very, very good method. And a lot of dermatologists use it. I used to use it in the past, but I find that surgery together with flap repair is a little bit more finesse in that, because it takes time after the laser for your wounds to heal. So certainly laser, can it be used? Yes, it is. It can be an excellent method. Here's one of my colleagues actually using an Elman electrodesiccator, removing the keloid tissue or fibrous tissue, and that wound's basically left to heal. The second treatment, and this is a treatment done by, I think it's Sandra Lee. So what she's doing here is she's putting some intralesional steroid together with local anesthetic prior to using what's known as a cryoprobe. So a cryoprobe is basically cryotherapy. We're freezing the steroid. So you can see it's actually skewering it through. Liquid nitrogen goes in and it is frozen. So it's rock solid, and over time that will thaw out and the skin will die. And the necrosis, in other words, the death of the collagen and the keloid, will dissipate the keloid over time. I don't quite like using this technique because it's not that reliable and it takes many treatments, and it's pretty uncomfortable for the patient as well post-treatment. So here's my method. It's a little bit more fiddly, but I think it is the better treatment. So what I do is I do a surgical excision with a flap repair. So step one is basically the surgery. So I excise the keloid, but I don't excise the entire keloid. I leave the skin intact, and I'll tell you why. It's because it's a markedly improved healing time. So here I'm cutting out half the keloid. I'm going inside and I'm basically scalloping the keloid tissue out. Once again, it takes a lot longer than laser, but believe me, it heals up a lot quicker and the cosmetic result is much better. So because the patient still has a flap of skin left, the wounds just heal up a lot quicker. So here I'm scraping away the excess tissue from the keloid using a curette. Certainly if I had an electrodesiccator like an Elman, I'll use that, but the curette will be fine, and this is what I do. So now for the other side, it's exactly the same process. I do an incision right down the middle, as you can see. If I was using a laser could do the same, and certainly I do sometimes use a laser to actually make that incision because there is less bleeding. But with the scalpel handy, look, I'm pretty quick with that. The whole procedure itself takes about, look, realistically 20 to 30 minutes. And here I'm scalloping away the keloid on both sides, but leaving one side intact. So you can see me scalloping out with the curette. One side of it is gone, so you can see I'm actually leaving skin there, and the reason why I'm leaving skin there, and you will see shortly, is because I suture everything up. So this is the keloid before treatment on both sides, secondary to ear piercing, and this is after. So basically, skin flap closure equals faster healing times, much nicer cosmetic result. Step 2 is the most important bit, and that's pressure. I always use pressure earrings, and this is vital to get a really good outcome. The recurrence rate in my hands, less than 5% if you use pressure earrings. So earrings come in all shapes, forms, sizes, colors, everything that can do with fashion, it's there. So what are the expected before and afters? This is what happens. Pressure earrings, 3 months, always use pressure. As you can see from the video, there's so many other ways to treat keloids, everything from cryotherapy through to cryoprobes and even laser surgery. I find that surgery coupled with pressure dressings gives me, at least in my hands, the lowest recurrence rate and the best results. So once again, take heed to what your dermatologist or plastic surgeon has to say, because they probably have a very similar method that works equally as well. So hey guys, thanks for watching this video, and please remember to subscribe for more information on anything laser and aesthetic dermatology wise. Really appreciate your support. Thanks for that.